So being in the ICU for 3 years let me apply, and this is as of the new year, for a new position as rapid response nurse. So if you've been in a big hospital, our hospital has 700 plus beds. It's pretty big, biggest one in the area. And we always have a rapid response nurse and a rapid response doctor and a rapid response respiratory therapist on call for rapid response calls. Those are basically calls from the floor where they basically want an ICU nurse to come to bedside because they feel like their patient is kind of going down the drain, is headed towards something bad. Basically, when they call a rapid response, we're trying to prevent a code. We're trying to get to the patient before something catastrophic happens. This could be the patient, a patient is breathing, it can't support their airway, they're breathing out of control. Looks like, they're gonna need to be intubated and put on a vent just for airway and breathing support. Or maybe their heart rhythm is changing, maybe they've gone unconscious and they're not waking up. So the nurses on the floor can call a rapid response, meaning they'll get an ICU nurse there as well as at our hospital, it is the ICU hospitalist will show up, as well as respiratory therapists to help with any airway and breathing, pulmonary support. It's really cool. The rapid response nurses are based out of the cardiac ICU at my hospital. So having worked there for 3 years, my manager already knew me and she was the one who hires the rapid response nurses. So I am now a full-time, still on night shift, rapid response nurse. There's always one on call, or one who's there in hospital ready to take calls. And that's what I do now. So I officially kind of just started. So not only do we, which some different hospitals probably do it different ways, it used to be that we would just hang out in the ICU, kind of act as a floating ICU nurse in the cardiac ICU helping out with stuff, and then just respond to calls when we would get a call. But now we actually do active rounding. So it's basically we are a roaming ICU nurse. So we round by all the departments in the hospital. It is a job that requires a lot of walking. So I do have some good shoes. But we round by all the departments. We just check in with the charge nurses. Are there, ask them, are there any patients that are looking unstable that you want me to check out? And we're just always there to, help with patients that are looking a little unstable, see if we need to move them to an ICU. So we do this rounding, or they can call us. We have these little Vocera things where they can call our little radio thing, whatever, two-way radio, whatever. And they can request us to just come check out a patient before actually calling an official rapid response call. Because once you do call the rapid response call, the doctor shows up, the respiratory therapist shows up, I show up, our house nursing supervisor shows up to help arrange for new ICU bed placement should that need to happen. So once you do an official rapid response call, a good amount of people show up. Usually a lot of extra people show up, just like if you call a code, that being, someone's lost a pulse. So in this case, we're getting there, patient still has a pulse. They just have some really unstable condition that needs to be checked out and probably moved to the ICU. So anyways, without rambling too much and staying on point, we do the rounding. We carry around this bright orange backpack that has gear in it. Should we need to do anything? Should we need to quickly place an IV or draw some labs? I guess the way that I actually get the calls is on the iPhone. We get basically a text that says rapid response to this room, and we go from there. It's usually the secretary who has to place the call to some computer system that initiates the call. Once a rapid response call is initiated, and we are at the bedside, we take over as the rapid response nurse. We'll do all the charting. So on those little little vital sign machines that you check blood pressures on, heart rate, O2 sat, all that. We print out the vitals. We're taking the vitals at least every 5 minutes while we're on the rapid response call, and we save those, and we actually do all the charting from the time the rapid response starts. So, I mean, we go through the whole rapid response, and then we go back and we chart everything. And we use Epic at our hospital, the Epic charting system. So there's a whole just flow sheet for a rapid response, makes it real easy. But anyway, so we show up. We, as the rapid response nurse, sort of lead the situation. We assess the patient. We ask what just happened, what meds did they just get. We try to think through what could have led to, like, all of a sudden the patient is not waking up, they're not responding, they're breathing really slow. Did they just have a ton of pain medicine that could have zonked them? Or what could happen? Are they having a stroke? Once we're there, we can activate another alert called a stroke alert, which gets a stroke coordinator person there who can help initiate stroke orders if we have to do that. Or we can activate a new one we have as a sepsis alert, so we can show up, and if it looks like the patient, and they can call a rapid response should the patient, have a temp of 103, they're breathing fast, their pressure's dropping, does it look like they're septic but they haven't been being treated for it yet. They can call a rapid response. It just initiates a quick response to something like that. Anyway, so yeah, we respond to these rapid response calls to basically urgent situations that that could use an ICU nurse and a ICU doctor there urgently, and respiratory therapist. So there are other times where the call, we show up and maybe it's not as urgent of a situation, but the nurse was still feeling uneasy. Sometimes in those cases where we don't need to move the patient to an ICU, where maybe it's not as critical as most of the other rapid response calls, the responding hospitalist might just coordinate with the primary team, the primary doctors who are taking care of the patient in the hospital, and just kind of get them up to speed and talk with them about the next stages of care. So it's a good thing for hospitals to have. You should let me know if your hospital out there has something called the rapid response team. Is it similar to ours, where we do rounding and then we go to calls? What do they call it? Do they do anything different? It's cool. I like it because I've stepped away from the bedside in a way where I'm not assigned patients when I show up to work. Rather, I'm just given a phone, an iPhone, this little Vocera thing that they can call me, and a backpack. And I get to roam around, I get to check on people, I get to make a lot of new relationships. And it's cool, I just get to jump into all sorts of situations. So that's what the rapid response nurse position is. It's a lot of just getting there, coordinating the next moves alongside the doctor, basically being that person to get them to the ICU should we need to, or stabilize them there on the floor, or take them to an urgent scan, head scan or something like that. I'll hopefully, as I do it for a while, I'll give y'all another update about that. But a prereq to getting that rapid response position was we did have to work in the ICU. Let me know what your hospitals require for that position, if you know of, any. Anyways, if you have any other questions, feel free to put them down in the comments, or you can find me at NOWSKI and talk to me on there. That is the Instagram I use to engage people about this nursing stuff. And I'm going to probably keep doing the polling thing in the Instagram stories where I ask you what topics you want me to talk about. The other option when I did this poll was to talk about grad school options for registered nurses, like what you can do in grad school or things you can go study. I'm still going to do a video about that. So just be looking for that one pretty soon, I guess. Anyways, thanks for watching. Feel free to subscribe if this is the first time you're seeing my channel or one of my videos, and I will be back in another one. See ya.